Hello everyone and welcome to a new video. So the video topic of today is about the Burkitt lymphoma, and here we will talk about some facts about the Burkitt lymphoma and then the classification, the pathophysiology, the microscopy, the immunohistochemistry and the treatment. So let's start. Let's start with some facts. So Burkitt lymphoma is one subtype of non-Hodgkin's lymphomas, and it is a B-cell tumor, so it affects the B cells. And it is named after Dennis Burkitt, the Irish surgeon who first described the disease in 1958. And it is most common in developing countries and affects children. Now for the classification of Burkitt lymphoma. So there are three variants of the disease. There's the endemic variant, there's the sporadic variant, and there's the immunodeficiency associated variant. And we will talk about each of those in the next slides. So let's start by talking about the endemic variant. So the endemic variant almost always associated with the Epstein-Barr virus infection. The EBV causes infectious mononucleosis, and the endemic variant expresses CD21 marker. It is also the same receptor affected by the APV virus. The virus gains entry to the B cells through this receptor. The endemic variant common in regions where the malaria is endemic, such as the Africa and New Guinea, and it affects children 4 to 7 years old, and the male to female ratio is 2:1, and it is present mostly with facial mandibular masses, same as this boy in this picture has some mandibular mass, and it also present with abdominal masses or masses affecting the nervous system. The second variant is the sporadic variant, and is common in America and Europe, and it also occurs in children. Most of the times the male to female ratio is 4:1, and the sporadic form mostly present with abdominal masses in ileocecum and peritoneum regions, and it also affects the bone marrow and the nervous system. The third variant is the immunodeficiency associated variant. It is associated with HIV infection and in post-transplant patients. It presents in adults 40 to 45 years old, and the male to female ratio is 1:1. And it affects the GI tract, the lymph nodes, the bone marrow, and the nervous system. The pathophysiology of the Burkitt lymphoma is that there is dysregulation of c-Myc gene by some type of chromosomal translocation. The c-Myc is cell growth promoter, and translocation leads to overexpression of this gene, and it's a cell growth promoter. When you overexpress this gene, this would lead to uncontrolled cell growth and tumor growth. Regarding the microscopy, the tumor consists of cells that are similar in size and morphology with high proliferative and apoptotic activity. And there is also scattered tangible body-laden macrophages containing apoptotic tumor cells, gives the tumor starry sky appearance on low power microscopy. Starry sky is a term that is a lot used in exams, so pay attention to this term. So basically, because of the macrophages containing apoptotic tumor cells, it gives the tumor starry sky appearance on the microscopy, like this picture here. Immunohistochemistry, the tumor expresses markers of B cells, CD19, CD20, and CD22, and it also expresses the CD10 and the BCL6 markers. Mantle cell and diffuse large B cell lymphomas also expresses the CD19 and CD20 markers. For the treatment of this disease, the first line is chemotherapy using one of these protocols, and tumor lysis syndrome could occur in these patients due to fast response to chemotherapy, so pay attention to this complication. So with that, we reach the end of this video. Thank you guys for watching. Please make sure to like and subscribe. And if you want to support more, you can by subscribing to the Patreon. Link is provided in the description of this video. Thank you for watching and peace.